We've started the webcast now, Chairman.
Thank you very much, Jackie. Good morning, everyone, and welcome to this virtual meeting of the Children and Young People Select Committee. The meeting is being webcast on YouTube via the County Council website. I'll begin by reading the names of members on the committee so they can confirm their attendance for public record. Members, when I say your name, please unmute and confirm your attendance, and then we can ensure that you'll be heard throughout the meeting as well. During the meeting, if a member wishes to speak, they will indicate this to me by raising their hand, and I will call them to speak in turn. All decisions will be reached verbally. I would like to remind members that the County Council's standing orders continue to apply. Please keep your microphone muted unless you've been called to speak, and you may be visible on screen to the public and to other members even when you are not speaking. So myself, Kirsty North, I'm here. My Vice Chairman, Councillor Ray Bolton.
Present, Chairman.
Thank you. Councillor Jackie Branson.
Present, Chairman.
Councillor Anne Briggs.
Present, Chairman.
Councillor Zilia Brooks.
Present, Chairman.
Councillor Fran Carpenter.
Present, Chairman.
Councillor Peter Edgar.
Present, Edgar.
Councillor Powell Hare.
Present, Chairman.
Councillor Wayne Irish.
Present, Chairman.
Councillor Gavin James.
Present, Chairman.
Councillor Neville Penman.
Present, Chairman.
Councillor Jackie Porter.
Good morning, present.
Morning. Councillor Robert Taylor.
Present.
Councillor Malcolm Wade.
Good morning and present, Chairman.
Councillor Michael Westbrook.
Present, Chairman.
Thank you. Councillor Bill Withers.
Present, Chairman.
Thank you. Ian Brereton, our Parent Governor Representative for Secondary Schools.
Present, Chairman.
Thank you. Gareth Davis, our Parent Governor Representative for Primary Schools.
Morning, Present, Chairman.
Kate Watson, our Parent Governor Representative for Special Schools. Okay, Robert Sanders, our Church of England Diocese Representative.
Morning, Present, Chair.
Thank you very much. And we also welcome Councillor Patricia Stallard, the Executive Lead Member for Children's Services and Young People.
Thank you, Chairman.
And Councillor Ros Chad, the Executive Member for Education and Skills.
Thank you, Chairman.
Thank you very much. So I think we've got a full house, but I'll just go to Jackie in case we have received any apologies.
I've not had any apologies, and looks like Kate Watson is here. I just think her microphone was on mute, so we've got full house.
Perfect. Thank you, Jackie. So item 2, declarations of interest. If any member would like to declare an interest in any item being discussed today, could they either declare it now or at the time that the item comes onto our agenda? Can't see any hands, so we will move on to item 3, which is the minutes. The minutes of the meeting held on the 28th of December 2020. Does anyone have any queries over the minutes? Okay, in that case, can we just agree those? If I see lots of nods, I will accept.
Agreed, Chairman.
Perfect, thank you. Item 4 is deputations. We haven't received any deputations today, so we will move swiftly to item 5, which is my chairman's announcements. So members will be aware that today is Armistice Day. As such, we'll be holding a 2-minute silence at 11 AM to remember those that have fought and died for our country. At the time, I will try and interrupt whoever's speaking just before 11 and announce that to remind you all, if you can keep your microphones muted during the silence, we'll let you know when you can resume. The webcast will continue throughout, so just to make members aware. Also, you'll recall that at the September Select Committee, we agreed an additional recommendation in relation to the Autism Assessment Services. And you'll have a copy of the letter sent to the Chief Executive of Hampshire and Isle of Wight CCG Partnership requesting due consideration to a preventative model of funding for autism assessments. So we will keep you all posted on that. So we'll move straight on to item 6, which is the proposed changes to the short break activities programme and consultation outcomes. I believe this is being presented to us by Sarah Roberts, and I'm sure Steve Cocker will come in as well. So at this point, I will hand over to you.
Thank you very much, Chair. And I think probably you've all had the paper, but we've got a presentation just to walk through, which synthesises some of the aspects in the paper. And I'm going to hand over to my colleagues, Suzanne Smith, who's Assistant Director, and Sarah Roberts, just to walk you through the presentation for the next 20 minutes or so. So over to you, colleagues.
Thank you, Chairman. I'm hoping I'm sharing my screen. So yes. I'm going to bring to you the results from the public consultation following Council decision last November to progress savings indicated on the short break activities programme. I'll explain briefly the context of those savings, how we conducted the consultation, and then primarily spend time looking at the proposals and consultation feedback for you. So in terms of the savings, we have a £16.8 million children with disabilities budget, which is where the short breaks budget sits. And the children with disabilities indicative target is 1.3 million, of which the short break savings target is £696,000. In terms of the service, the council has to provide a range of services to enable parents to care for their children and young people more effectively. There's a range of services that includes specialist services, which were outside the scope of this consultation, but there are times of which those services have to be provided. The means we do so is via a grant to short break activity providers, and I'm sorry, it's jumped, and a community buddy scheme of 140,000, a grant to Hampshire Parent Carer Network for participation and to maintain the Gateway Card scheme. We have around 2,500 Gateway Card holders, which is the means of accessing a short break activity. And in the last financial year, 550 of those attended a short break during the year. As you can see from the graph on the right, attendance is variable, with most card holders only attending up to 10 times, but we do have some high usage. So in terms of the consultation, we began on the 9th of March and we held some pre-engagement with Hampshire Parent Carer Network. We produced information in a variety of means: online, printed forms, easy read for adults and for young people. And we supported that with a variety of web pages, of news items, emails, social media, school comms, member briefings and other news articles. And they set out the 8 proposals. Obviously, 2 weeks afterwards, we went into national lockdown. So I prepared a slide for you that sets out how we flexed our approach in response to the pandemic. So we had to move from in-person sessions. We held one, we moved to virtual. We held sessions over the phone via Microsoft Teams, looked at a variety of times, including evenings. We produced videos. We offered support via Hampshire Sendias, and we offered facilitated questionnaire completion sessions, telephone slots, and promoted the paper packs for those who couldn't get online. And providers were able to hold sessions with children and young people. And you'll see from the graph on the right, I'm sorry, it's jumped again. You'll see from the graph on the lower right that the effect of the lockdown, where there was no activity, but there was consistent activity throughout the period, which we extended by 6 weeks. So it ran for 18 weeks in total. This slide sets out how popular or unpopular some of those questions were and those responses, and who we received feedback from. So on to the proposals. Because the scheme was reviewed 2 years ago and streamlined, it effectively meant that the opportunities for achieving savings were reduced. And so primarily most of the savings are being sought from Proposal 1, which is to reduce the overall grant, but to continue to commission the short break activities according to priorities that are agreed with parents. And the reason we think we can do that is that in the current round, we managed to purchase more places than we anticipated. Only 21% of cardholders accessed the activities, and most providers tell us they rarely have a waiting list. In addition to that, so we have surplus of places and some haven't been taken up and schemes have had to close. As you can see, this was our least popular proposal, with 82% of respondents disagreeing. However, the opportunities to achieve the saving within the budget are limited, and therefore this proposal is recommended for implementation, with a range of proposals there to help mitigate the risk, mainly focusing on continuing to focus on our priority areas and to make sure that the money is targeted to where the usage is. We, in response to feedback, will see if autism is a priority area within the next grant round. We do continue to offer subsidised rates for families on low incomes. So that's Proposal 1. Proposal 2 sought to either remove or reduce our exceptions fund and target a saving of between £70,500 and £90,500. We're proposing, in line with public opinion, to reduce the fund to £20,000 for exceptions and enable the opportunity for ad hoc applications to the fund. Proposal 3 sought to seek short break activity providers to seek a minimum level of match funding from other sources in a bid to make their schemes more sustainable. This wasn't a particularly popular option, and given the impact of the COVID-19 pandemic, whilst it's something we might wish to revisit in future years, this doesn't feel like the right time. And so within the grant round, we would propose to ask for minimum funding, but not seek to impose a minimum level. We also asked about an optimum grant period, and we would propose a 2-year grant allocation to be implemented in a bid to provide a degree of certainty both for providers and for families. Proposal 4 was to halve the grant awarded to Hampshire Parent Carer Network in reflection of the proportion of work which they conduct for Hampshire Children's Services. We've been topping up their DFE annual grant each year by £35,000, yet only about half of that work is for children's services. That wasn't a particular popular option, with most HPCN members disagreeing who responded to the consultation. And other feedback was given about how valued the service is. So we would propose to implement the saving in line with the activity that is conducted for children's services, but in reflection of the work that they conduct for the clinical commissioning groups, Health have committed to contributing to that funding, so there'd be no net overall impact. Proposal 5 was not a savings target, but it was aimed to try and make the programme more effective and to work in conjunction with an external grant giving body. The response was largely ambivalent, and given that there's no clear advantage with implementing it, we would propose not to progress with this option. Proposal 6 sought to introduce a 2-tier gateway card scheme. That's partly in response to parents telling us that they use their card to obtain obsessions and concessions, and not necessarily intend to attend a short break activity, and also would enable us to more tightly target provision for those that do intend to attend the activities. And this was largely popular, and we set out a range of evidence that would be required to support that extra tier, and that was also endorsed by the survey responses. So we would propose to implement that. That will require some enhancements to our IT system, and we would seek to do that for new cardholders from April and for existing cardholders when they next reapply. The next proposal was to place a limit of 30 sessions per child per year in a seek to try and even out uptake. There was equal agreement and disagreement from the respondents in the survey, and we've decided not to recommend this for implementation. Instead of trying to impose a formal cap, we would periodically review in conjunction with social care teams the instances of high uptake to make sure that the support that families are receiving is appropriate. And finally, Proposal 8 sought to redesign the Community Buddy Scheme. It's a popular scheme where demand outstrips supply. The proposal was to have a single organisation to recruit and coordinate buddies, to look at different types of buddy offer, and also some savings or contributions in terms of increasing parental contributions, which have been the same since 2012-2013, and similarly for mileage. The other proposal was to bring this scheme in line with the rest of the short break activities and no longer provide to 18 and 19-year-olds, nor to those young people living outside Hampshire. The response was largely against the contributions increases, supportive of the redesign, and not a lot of support to stop funding for over 18s. In line with feedback from the consultation around the preferred increase of mileage, we would propose to increase that from 25p to 30p from April, in line with that public opinion, and similarly increase the parent carers contributions from £5 to £6.50 per hour. They would contribute up to £7,000 towards the scheme given current activity levels. From April, we would propose that young people over 18 or over would not be able to access the scheme, and we would work with Adults Health and Care to liaise with those families and make sure they are signposted to the appropriate support. And then we would seek to redesign the service in terms of how we capture referrals and what the offer looks like, and aim for a relaunch in September 2021. And that concludes the presentation. Thank you very much for listening.
Thank you, Sarah. Are we going straight into questions, or would you like Suzanne to add anything at this point, Steve?
I think members have got the report, so I would suggest we just go straight into questions.
Okay, we'll go straight to Councillor Powell-Hare, please.
Good morning. Thank you, Chair. Can you tell me, Sarah, are the gateway cards means tested? If not, why not?
No, they're not. It's an open access scheme. So it covers families that are known to social care and families that aren't. And anybody can apply that can produce the required evidence. In terms of why it's not means tested, I might have to ask Suzanne.
Yeah, it's fine. I can come into that. It's because that's the scheme. In other words, what the government, if you go back to the origins of short breaks, it was specifically an open access scheme for children with disabilities. So in other words, it's not designed to be means tested, and rightly we would be challenged, I think, if we were to introduce a means test on this, because that would bring it into a different, it would be like the social care threshold at that point. So for this particular scheme, as the government have defined it, I don't believe we can do a means test.
Thank you. Thanks. Councillor Anne Briggs, please. We're struggling to get Anne, I think. I'll come back to you. Councillor Bill. Oh, we can hear you. Go for it.
Thank you. The exception fund. A lot of people didn't seem to know it was there. Is there a reason for it? There was lots of comments when you read all through it on that question. Could you explain why people didn't know it was there or how it's used?
So the exceptions fund is advertised with all our children's services grants, and all providers are made aware of the exceptions fund through that means. I think we get the majority of bids through our main grant round, and providers know when that is, when the grant window opens, and therefore that's where the majority of activity comes from. We have received some applications through the exceptions fund. They come through periodically rather than through a set window, and it's for providers to apply to us rather than parents. So it may be that most of our respondents were parents, and actually the fund is not targeted to them, it's targeted to providers.
Thank you. May I ask another question, Chairman?
Yeah, go on then.
Thank you. At the start, you said you purchased a lot of activities which were not taken up. Is that because you didn't find out first what people needed, or could some of because Hampshire is such a wide area and you can't cover all of it with the activities, do you need to look at what is available in each area instead of just purchasing wildly?
So the last grant round had considerable engagement to determine what the priorities were prior to going out and letting the grants. And there wasn't a grant allocation in each district. That was the model that was set up to provide coverage. Largely we're in the hands of the provider network and who is available to provide. We did work with a provider to set up some provision in an area where there wasn't any, and that was one of the schemes that closed because although we envisaged demand, it wasn't taken up.
Would you mind if I just added to that? It's worth remembering that we commission these activities by way of a grant rather than a contract. So if we were contracting for services, you would absolutely expect us to have a very precise number of places that we are paying for. With the grant, it's slightly different. We make available a pot of money and we ask the voluntary sector to tell us what they can deliver for that money. And that's where the variety comes in terms of different providers can use that money and make spaces available in different ways. So it's quite difficult for us to predict in advance what those providers will come back to us with. So like Sarah says, we make an allocation available based on what we know about the number of gateway card holders in each district as a kind of indicator of what we think we need. But what we learned in the last grant round was that providers were able to make that money go further than perhaps we had expected, which is why we've ended up with more places than we've perhaps needed.
Thank you. Thank you, Beth.
Councillor Bill Withers.
Thank you, Chair. As a county councillor and employee of the county, it's always difficult when examining the data that you provide to ascertain what the actual uptake was, particularly in our deprived areas. When you see the numbers, are so small in some of the areas, how can that be better explained to us? I mean, you've got rich, you've got middle class, you've got lower class. It's very hard when you're looking at the percentages to ascertain, what we should be looking at. And I know, Steve, that it's a generalisation, but it's hard for us on the ground to actually see if people are aware or taking up the opportunity, and if they're not, why not?
Yeah, I think there's a couple of things. They're quite general points that I'd make, and Sarah and Suzanne might come on to some specific points. In a general point, when we talk about communities, we often talk about locally based communities, don't we? The community of Lee Park or the community of Waterlooville, or perhaps even smaller. Families of disabled children actually have more of a community of interest, if I can put it that way. They tend to network with each other, and increasingly, since over the last 10 years, those networks are online through Facebook, through particular websites, and there's quite a good set of engagement. And parents for children with special educational needs are very well linked up, as I can testify, because I get a lot of the same sorts of letters. There is something within that which points towards more articulate and more able parents being more able to access resources, and that's an issue for us, and we understand that. But those parents do tend to, as I say, identify with the community of interest rather than a local community, and that's because they see commonalities with other parents about what they, what they want and what they need. So, for example, our local offer is online. And that's well used, actually. And a local offer, sorry, I should explain. A local offer is the offer for disabled children and children with special educational needs. It's really well used and well understood. And you can filter it by all sorts of locations and so forth. So that's one thing I would say. The second thing I would say is that in any universal system, and going back to Councillor Hare's question, this is a universal programme targeted to children with disabilities, but with no further targeting, if you see what I mean. Within that, you will always have people who use more and some people who use less. And that is the case with any universal system. You can think of GPs or whatever. Some people use their GPs a lot, some people don't. It's just how things are. The question for us is, can we get the right kids to the right support at the right time? And we continue to, we work hard at that. And the other link we've got is with special schools, because many of the children that are most in need are at special school. A lot of activities are progressed, not all within the remit of short breaks, actually, but special schools do a lot with those kids. So there's a sort of, aspect of that, which is around what else do they need. So those are the sort of general points I'd make, and those points are pointing towards it being tricky sometimes to get everybody engaged that we might want, and usage to be exactly as we want. But it's the nature of a universal scheme that you don't limit it when other people use it a lot. Although one might argue that could be a more efficient use. When it comes to particular areas, I think we've tried really hard in this and in previous sessions around engagement, and we can talk about some of the engagement we've done with parents over the years. But ultimately, we do need them to step forward, and the buddy scheme was also part of that in helping those parents step forward, and that's something we want to also focus on. I don't know if Suzanne or Sarah, you want to pick up anything more from my general points there.
I think the only things I'd add is with when we introduced the new gateway card system in 2019, what that enabled us to see in kind of near real time is which children are accessing which activities and what are their primary needs. And so we do have a much better understanding now of who's accessing where. Obviously that helps you with people that know about the scheme. As Steve said, we work really hard on our local offer, but we have got more work that we want to do on that. And one of the priorities around our our local offer is to make better use of social media, because actually some of the things we hear from parents and from providers actually is it can be quite kind of cumbersome to navigate a system, and actually a lot of people, you know, organise their lives and their events around social media now, and HPCN have moved largely to working with their families through social media, and it's been really successful. They've got much wider engagement than they've had in the past, so that's a kind of key priority for us moving forward. And I feel that might help us to access some of those people who perhaps, you know, haven't engaged with the scheme in the past, just in a different way.
If I can come back, Kirsty, please.
Go for it.
Yeah, Steve, thank you for that, and thanks for those comments. I keep saying on various committee meetings, you know, we are your eyes and ears on the ground, and if you notice that there is a shortfall or no uptake in our areas, then we are the people on the ground. And you know, we do put our annual grants towards various organisations where we are helping them achieve certain things, and I know it's difficult sometimes to realise that we're both going down the dual carriageway, but not necessarily in the same lane. And I think, you know, as county councillors, we appreciate all the professional work that you do on an annual basis, but sometimes we just feel that we're on the pavement. So
I think that's a really helpful point, actually, Councillor Withers. And maybe there's, as we go forward in this, maybe there's a way of bringing members a bit closer to this. Yeah, I'll leave it there. But I think there probably is something that we can do a bit more, that is a bit more engaging with local members in local communities, bearing in mind that within your own constituencies, you'll probably have very few families who have got children with disabilities. The nature of it is that they're spread out across the county, so it won't be a general point for you. But I accept your point, basically, is what I'm saying. I think there's something more that we can do around that.
Yeah, I mean, in Rushmore, we have 5 county councillors. So, you know, together we could be a team working with you.
But maybe that's the way forward. Yeah, thank you.
Thank you.
Councillor Jackie Branson.
Thank you. Really just going on from that point that we've just had, obviously representing an area of deprivation. I was just wondering, you've got a mileage, you're putting up the mileage for cars. I just wondered how many people don't have cars. Is that an issue that some people can't access these breaks because they don't have transport?
So the mileage is for the buddy to travel to the young person that they're supporting, and they claim that back from us. There is no transport element of the short break activities, the wider programme.
Do we find whether any people don't access any of the short break period activities because they don't have transport? Is that an issue? Why the take up in some of our more deprived areas isn't as good as some others?
I think I know in the previous set of analyses that were undertaken, the distance travelled to each type of activity was analysed. So a lot of people were travelling to their to locations. As Suzanne said earlier, we've tried to make sure that there is provision across the county in all the districts to try and address the scale of the county and the need to try and minimise transport requirements.
Okay, thank you.
Councillor Ray Bolton. Are you there, Ray? We'll come back to him.
No,
Councillor, oh,
there now.
He's here. Ray, go ahead.
Can you hear me and see me? Sarah, thank you for your presentation. Your chart on proposal 1 under next steps. The 4th and 5th bullets down, the 4th one, determine if provision for children with autism should be a priority within the grant round. So my question on that bullet is, how do you propose to determine that? And the next bullet, the sixth one, continue to offer subsidised rates for activities for families on low income or receipt of benefits. Could you explain a bit more about that and how you propose to achieve that going forward? So 2 separate questions on those 2 bullet points. Thank you.
So in terms of the children with autism, through the engagement that supported the consultation, some parents fed back to us that they felt that either there wasn't provision for their children with autism who didn't have moderate learning disabilities, and that was actually endorsed. We engaged with the National Autistic Society South Hampshire branch for the first time as part of this consultation, and they fed back similar. And so we are liaising with Hampshire Parent Carer Network to agree our priorities as we do each year, informed by the consultation feedback. So that's how we're taking forward that proposal, and then we would include it as a specific element of the next grant round. In terms of the subsidised rates for low income, we have a charging and remissions policy that came into being after the last review. And so we review that annually, and we're in the process of doing that at the moment. And that is a policy that we ask all the providers that receive grants from us to make sure that they undertake, and their grant bids include an element for those sort of hardship cases, as it were.
Thank you, Sarah.
Just check, can I just come in and just clarify something?
Yeah.
It's going back to Councillor Hare's just a question right at the beginning, which is supporting families with low income is not the same as a means test. It's because you exclude from a means test, not include. So I just want to be really clear about that. So we do, you know, we do evaluate people's incomes, but that requires us then to support them, not exclude them. Yeah.
Thank you. Councillor Zilia Brooks.
Thank you, Madam Chairman. I just wondered, with all this consultation and what went through all these weeks and everything, how many parents actually got in contact with you to say, to express their actual concerns? I mean, like the parents, the providers, and parents network people. About their concerns about the recommendation to reduce the short break budget, please. Thank you.
So in the presentation, there was a slide that set out how many responses we had. So we had 200 individual responses that came in through the questionnaire route. And when we held the engagement sessions, there were 47 individual parents that attended those, and they brought forward 134 points that were incorporated within the analysis of the response of the survey. Sorry. So I hope that answers your question about how many people. That doesn't include providers or young people.
Yes, just to come back. I mean, personally, did they somebody actually send you an email? Not just on the survey, actually sent you an email, a letter, phone conversation saying, look, I'm not happy with this. How many actually single people actually got in contact with the officers or the portfolio holders?
Outside of the engagement sessions, we didn't receive any responses through those mechanisms from individuals. We had one from Basingstoke Borough Council, and the young people's feedback came through as unstructured responses, is what we call in response to a survey, unstructured responses.
It's not that, if I can just jump in, I think that's that surprising, because if we essentially created a mechanism for people to give their feedback, so they probably wouldn't use, they would use that mechanism and not go outside that, I suspect. But they were free to do so, but most, you know, the vast majority of people clearly chose to use the mechanism we created.
Because I remember, wasn't it last year, the Parents Network actually done a deputation last year, and I just wondered, they haven't come forward this time, so That was just my concerns.
Yes,
Thank you.
that's their choice. We've been in dialogue with them. They're not. It's not a secret.
No. No, not suggesting there was. Thank you very much for that, though. Thank you.
Chairman, as the Executive Lead Member, can I just add to the point that Steve Crocker has made, that I haven't received any emails, nor have I received any deputations. And in fact, the last informal meeting I had with the Hampshire Parent Carer Network, they were understanding of the situation we find ourselves in.
Thank you, Patricia.
Thank you.
Councillor Jackie Porter.
Thank you. I just was going to ask you, Chairman, through you, for the views of governors at this meeting about this, because one of the challenges of this, I appreciate it was lockdown, but one of the challenges is that people couldn't necessarily imagine, or can't necessarily imagine, what the future is going to hold for this group of young people, and their reluctance in many cases is about the possibilities even at this stage. And I appreciate I haven't received any emails either, which is extremely unusual, I have to say. But my understanding of this as well is that these are effectively short breaks are things that money can't buy, in the sense that they are supporting children to do the things that other children do. And so there's an equality of opportunity here. And I just wanted to ask if that is still our view, or whether respite, as is stated in this statement here, or whether that is part of the aim of it, because my understanding last time was that it wasn't. So it says, as far as reasonably practical, a range of services which is sufficient to assist carers to continue to provide care or do so more effectively. I just wanted to know exactly what the remit of that is, whether it is partially about respite or if it is about the experiences for the child, and then also whether the governors have any view on this.
I'm struggling to work out the question. So is the question, first of all, what the governors make of it?
Well, no, that was a question separately, but my question is that last time when we looked at the short breaks, we were told that swimming, for instance, was people thought of it as a respite, so therefore it wasn't covered by this. But when we read the legal context this time, it says a range of services which is sufficient to assist carers to continue to provide care, or to do so more effectively. So is it about experiences that you can't buy for a child? So is it about those children's experiences, or is it partly about respite?
It is partly about giving families and carers a short break. It's inherent in the name of the programme. The reason we didn't continue with swimming is because parents and carers were in the water, and that's not by definition a short break. But the short break is then the purpose is to help those families, but also, as you allude to give, and going right back to 2007 and the implementation of this under Aiming High, was to give disabled children an equal stab at the opportunities that non-disabled children have. So part of the aim was to ensure that they could access things, and that, if you remember, at that stage there was quite a lot of capital that went
it was called Aiming High for Disabled Child. I remember it very clearly. So that's what I've always imagined that this is for, rather than the.
It's a bit of both. I mean, but the theory is that by aiming high, you ultimately give children, you ultimately give families some a short break. So it is a bit of both.
Right. Okay. I haven't received any responses this time either, but I don't know if that's because of the pandemic or whether it's because people are content. But they are.
Thank you, Councillor Malcolm Wade.
Thank you, Chairman. Yeah, it's interesting that at the moment we have increasing issues with young people and children, not just due to the pandemic. We have increasing mental health issues. We have increasing need for support. But we don't seem to have increasing need for short breaks, because that's been proven by the figures delivered by the presentation. Now, I know every time we have a spending cut, short breaks takes a hit. It's the local government equivalent of a death by 1,000 cuts. But you reach a point when you reduce the level of support to the extent that people don't bother going to it anymore. They recognise that they've got to find other ways to get the support they need. And the question is, do we recognise that this is in a holistic increasing demand environment, and I'm not talking about pandemic issues, which will be another issue, in an increasing holistic environment, if you start to reduce the support systems, people find other ways to support themselves, and that's why the reduction, so many areas are not being utilised as well as they could.
Yeah, I'm not sure that was the question. You answered your own question, haven't you?
Well, no,
But,
no, I want to know if you agree or not. Because we're part of the problem, not just the solution.
I think it's, I don't necessarily disagree with you, Councillor Wade. I just think it's a bit more complicated than that. I think that if you offer people a universal service of any type, whether they're disabled children or non-disabled or other sorts of services, people will use them because they are, by very nature, they're universal and they're there. The question, I suppose, is whether they're a want or a need, and that those are two slightly different things. And people may want those things to be there and may enjoy them, but do they necessarily need them is a more nuanced and difficult question to answer. What I suppose a crude measure is, do we see lots more disabled children coming into our social care services? And the answer is no, we don't really. We see pretty much the same level. We see an increase, but it's the same as the non-disabled children coming into care. So, but I'd be the first to say I think that's quite a crude measure and probably not necessarily the best one. There is, I think, there's an unknown factor which is COVID related about the degree to which families and carers will want to change their behaviours in future. We don't have at the moment significant demand for overnight respite because families see that as too high risk just in the current circumstances, and I don't blame them. But I don't know what that will then feed through to in the future and whether we might have more or less demand for that. So that's a little bit of an unknown, but I don't think it particularly relates to short breaks. I suppose my own view, based on what the evidence that we've got so far about usage of schemes, would be that we've probably got, well, we definitely have, if you look at the evidence, we've got a surplus of places. If we look at if we look at this in the round and look at the amount that we spend on this in Hampshire compared to other local authorities, and that's in the report, it's on page 24 of your ModGov papers, we're actually pretty, well, let me put it this way, in terms of our general spend on children's services, Hampshire is in the bottom 10%, and that's reflective of the funding that we receive. But in short breaks, we're pretty much in the middle. You can see that on the graph. And although, yes, we are moving to the right in terms of reducing our overall spend, you can bet your bottom dollar that all the other authorities are moving to the right as well, because this is one of the few levels of discretionary spend we have left. So the question is, do I think there's sufficient activities on short breaks going forward? I think the evidence tells us that there will be, and we are currently reasonably good at targeting those services, but there is even more to do in that area. Sorry, that was rather a long answer, but I hope it was a good and complicated question, if I can put it that way. I hope I've answered it.
Can I just come back with one point, Mr. Chairman, if I may? I take the candour of your answer. I get that. But you mentioned respite. I mean, we're in a new world, as we know. But post-COVID, and there will be one day a post-COVID, the demand for respite, which was quite significant prior, surely will come back. Because when people feel confident, because I don't see how the dynamic of the family interaction can change dramatically. Yes, it does now in this period of uncertainty and concern, but post this, when we get back to a level of normality, I can't see how that demand would not still be there.
Well, I don't know about that, if I'm honest, because I think one of the things that COVID is doing is it is having a different impact on family dynamics. So, for example, more people are working at home and they are taking a different view of their family circumstances. Now that has and I'll give you two examples. They're not related to this, and I'll be the first to say that, but there are two examples of how the family dynamic might be changing. One perhaps, well, I'll say it's neutral, but one possibly positive. The neutral one, arguably, is around elective home education. We're seeing a lot more families wanting to educate their children at home since the lockdown. Now, arguably, that is part of a reconsideration of the family being able to do that elective home education. One could argue it's a positive or a negative. That's why I said it's neutral, but we've certainly seen it. And we think that that will continue from the intelligence and feedback that we've got, because people are reviewing their circumstances. The other, perhaps a more positive one to think about, is, again, we've had an increase in interest for being a foster carer. And it's the same dynamic that drives it, which is about, well, I'm actually at home more, and have I got time to do things differently? And I think that dynamic may well play out in as yet unknown ways, but it may well play out with families of disabled children, and whether they want their care or their respite to be managed in a different way. And I wouldn't be surprised if that developed over the next 6 to 9 months, whereby they still want respite, and I accept that point, but they may want it to be delivered in different ways.
Thank you. We'll see, I suppose.
Yeah, that's all we can say.
Councillor Gavin James.
Thank you, Chair. The first one was about the Gateway card, and I've always been puzzled about how involved organisations that receive grant funding from the council via arts and culture are involved in accepting the Gateway card as a passport to their services. It seems that if we're providing funding through that avenue to an organisation, then clearly they should be, paying back that way. And it may be a way of sort of getting more activities included with the card without any extra additional cost to the council. And I'm thinking certainly things like museums that we may fund, such as milestones, an extra 4 children turning up actually cost nothing. So they could just accept the card as a passport into the service, and we get more for our money, if you like. The other one was about the overnight care, and I appreciate we're in a very strange time with overnight respite. But it's obviously an opportunity to sort of review how we build a sustainable overnight respite care service, because obviously it can't really happen at the moment. And what will it look like in the future? Are we using that opportunity to sort of redesign, reimagine, and have that sustainable service in the future?
Yeah, if I can. Yeah, okay, you go in the first one, Suzanne, I'll come in the second one.
Okay, so just in terms of the, I completely agree with you, Councillor James, around the kind of expanding and kind of enhancing the concessions offer, if you like, and by implementing the 2-tier gateway card, if that's approved this afternoon, we will be able to put some targeted effort into building that offer, which isn't something historically we've done. We focused very much on what we commission and pay for. So I think, we're thinking the same thing as you in terms of looking at where we can build that offer, where we can work with partners, particularly those that we fund. So one of the other suggestions that came through from another councillor was around, perhaps looking at car parking charges in country parks and the like. So that's absolutely on our agenda.
And I think the other thing I'd say is that I think families value the gateway card as a sort of evidence of entitlement, if I can put it that way, because not all children's disabilities are visible. I'm sure you know that, but it's just sometimes it's sort of it's proof, if you like, of eligibility. On the point about overnight respite, a point well made and taken. And yes, we are. I've got to say, it's not part of it's not part of the short breaks offer. It's distinctly different in terms of residential overnight stays or indeed other overnight care. So we are looking at that at the moment, but there's nothing in these papers about that. And in fairness, because of the reasons that I outlined to Councillor Wade earlier, our thinking is not yet progressed enough for decisions, because we need to see how this pans out post-pandemic. But I suppose I can assure you that your points are well made. It's right in our thinking as well, but we've got to give it a little bit of time to work through.
Thank you. I have a question about the buddy scheme. I know it's very popular, and from what I hear from my constituents living in my division, they find it difficult to access the scheme because of how popular it is and the lack of suitable buddies. So I'm sure they'll welcome the redesign of the scheme, but how will you encourage more people to come forward to be buddies? Because that seems to be the main issue.
So via a variety of means, initially to consolidate the oversight of it in terms of where all the referrals are coming in, and being able to then manage some expectations around where, you know, the geographical locations to work with providers, and try and get a bit more ahead of. At the moment it's very reactive, so they wait for an application and then try and find a buddy, but so to try and have a better lead time in terms of that centralisation and overview, to invest in that in terms of asking them to be responsible for a recruitment strategy to work with organisations to attract more buddies. At the moment that is with the providers themselves, and again they wait until they get an application to respond. And then the third way that we are exploring at the moment is looking at whether we can have some join up with our in-house volunteer service, and whether we can expand the availability that way. There are other options that one of the reasons that there's a slight time lag for the redesign is that we'll have some questions that we'll want to go back out to parents with, and one of those might be around whether it should be time bound and therefore freeing up some capacity. One of the issues is that for people that have got buddies, there is no kind of time limit or review. They've got them until they effectively reach 18 or the buddy leaves. I hope that helps.
It does. Thank you very much. I'm conscious of the time. At 11 we will all pause for 2 minutes, but and it may be that it's just come at a natural stop now because I don't have any hands, but I will take further questions after the pause if you like to stop someone mid-sentence. So if you'd all like to put your microphone on mute, and we will resume after our 2 minutes. Okay, thank you, members. Could I ask for any other questions or any second questions before I move on? My second question may lead nicely into debate anyway, but I wanted to ask Steve about the recent announcement the government's made, 2.8 million for children in Hampshire to have help with food bills and holiday activities, targeting those defined as vulnerable and those in receipt of free school meals. I appreciate there will be crossover for some between holiday club activities that they may get through this scheme and those that they may already attend under short break. So will that be developed and expanded with those in mind?
That's thank you, Chair. Great question. So you'll know that we got confirmation of the money last night, actually, and I didn't know the amount. I'd got two amounts that had been given to me by different sources. One was lower than that, than what we got. So we've got 2.898 million that has to last until the 31st of March. You'll be pleased to know, but she may not, that the person who's going to lead on this for us is Suzanne. And so the aim is precisely that we try to make sure that we complement existing schemes. There's been some really good work that was carried out over the summer in Hampshire under the Connect for Summer scheme. And we think there's something in that we want to try to replicate certainly in the holidays, but also perhaps at other times of the year, which is about encouraging parents to take part with their children, things like healthy eating and healthy cooking activities, but also giving kids a bit of activity and a bit of a break away from parents as well. So that feels like, and absolutely, we would want that to include children with disabilities as well. So this may well be quite a timely boost to our existing schemes. It is literally day one in terms of our planning, and so I can't really take it much more further than what I've just said, really, because we just need to work out how to do it. There are some parameters that are going to be given to us, but we haven't got those yet from government. One would envisage that we do this through using our voluntary sector contacts and our voluntary sector groups that are out there, some of which will be well known to families with disabled children. So I think it's a really timely boost and a really timely opportunity, and we'll try to maximise that over the next few months. We don't get any money till December, but so it means we've got about 3 weeks to try and put a plan together that will help us in this.
Thank you very much. It is welcome news, and it's good to hear that there'll be joint up thinking with this area. Any other second questions, members? I see no hands. Any debate? I also see no hands. So we will move to the recommendations. We will move down the list. Yes.
Do you want me to lead on these, Chairman, on the recommendations?
Yeah. Sorry, I thought that might be a request to speak, but it isn't. So we will, Jackie will lead on the recommendations and take us through the list going in turn.
Thank you. So moving to the recommendations to the executive lead member, which are set out on page 15 and 16 of the report. If I take one at a time, and can you indicate verbally whether you wish to abstain, are against, or are for each one? And this does preclude the co-opted members from voting on this one, as it's not an education matter. So recommendation A, which is proposal 1. Does anyone wish to abstain? If you could indicate verbally. Is anyone against the recommendation? I can then conclude that that's unanimous for the recommendation. Thank you. Moving to recommendation B, which is proposal 2 to the executive lead member. Does anyone wish to abstain from supporting this? No. Does anyone wish to vote against? And just to confirm that everyone is all in favour. Thank you. Can everyone just verbally sort of verbalise their in favour?
Agree.
In favour.
Agreed.
Thank you.
Agreed.
Sorry, I forgot to do that on the first one, but I did take that as a 4. On the recommendation C, proposal 3, is anyone abstain? Is anyone against supporting this? Please could you indicate if you're
Agreed.
or
Agreed.
Agreed. Thank you. I can confirm that everyone is in favour of that recommendation. Recommendation D, which is proposal 4. Does anyone abstain from supporting this? No. Is anyone against it? No. And can I take that everyone is in favour of this one?
Agreed.
Agreed.
Thank you. And moving on to recommendation E, proposal 5. Does anyone wish to abstain from supporting this? No. Is anyone against this recommendation? And I can conclude that everyone is for this recommendation.
Agreed.
Agreed. Agreed.
Thank you, members. Moving on to recommendation F, which is proposal 6. Does anyone wish to abstain? Is anyone against supporting this recommendation? No, I can take it that all members are in favour of this.
Agreed.
Thank you. Thank you. And just 2 more to go. Recommendation G, proposal 7. Does anyone wish to abstain from this? Is anyone against this recommendation? No. So everyone is for, is that?
Agreed.
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 Lovely, thank you. And the last recommendation, recommendation H, proposal 8. Does anyone wish to abstain? Does anyone wish to vote against? No. So everyone's in favour of that recommendation.
In favour.
Right. Thank you. Just to confirm that all the recommendations to the executive lead member have been supported by the members of the select committee. Thank you, members.
Thank you very much, Jackie. We can now move on to item 7, which is our annual safeguarding report for Children's Services. And I believe Stuart Ashley, our Assistant Director, will be walking us through this one, but I'll go over to Steve.
Exactly right, Chair. Stuart will walk you again. You've had the paper, but what we've done is extrapolated from that some sort of key information into a presentation that we'll walk you through in about 20 minutes, and then obviously open up for questions. So I'll hand over to Stuart, hoping he's in the list. I can't see him, but hopefully he's there.
I'm here. Thank you, Steve. Thank you, Chairman, and good morning, members. Just trying my technical skill of sharing my screen. Can you see?
That's it. Yeah.
Present. Yeah, great. Thank you. I'll make it full screen. So this is the annual safeguarding report for Children's Services that seeks to provide assurance to the Cabinet and members more widely of the safeguarding activity and our response to safeguarding issues in Hampshire. The report is set out, provides some details around the background to the service. It talks to some key developments. There's some information on performance and activity levels, some narrative around local developments, which are always important, and then turns to future challenges and operational priorities. And what this presentation does is pull out some key points from each of those sections. So as I said, the purpose is to provide assurance to members of the safeguarding activity of the department. And I suppose the biggest assurance that members can take, of course, is the Ofsted inspection of children's services last year. And as it says on the left-hand side of this slide at the bottom, that inspection is intrinsically rooted in safeguarding. It is the key aspect of that inspection. And we were fully tested quite forensically, I would say, in terms of that inspection. And as members are aware, we were judged to be outstanding. Notwithstanding that, things move on, and we can't rest on our laurels. And so the activity continues, and we continue to improve and develop our services and our response to safeguarding issues for vulnerable children. So in terms of key developments, briefly I'll touch on our response to COVID-19. The detailed response plan of children's services to the pandemic. Basically, we took a three-phased approach, with each phase being based on having fewer staff available. Unfortunately, in lockdown 1, we remained in phase 1, which is business as usual, but doing it differently. So virtual visits in the main, not exclusively, and virtual meetings, again, not in the main, but not exclusively. And we managed the service, I think, particularly well during that. As we came out of lockdown 1, we've seen a significant increase in demand, around about 15%, and that's been sustained since around May time. In addition to that, we've seen an increase in the complexity of work coming through to children's social care. Now we're in lockdown 2.0. We've taken exactly the same approach, more or less, in terms of being back in phase 1, so business as usual, but doing it differently. I think because we're better prepared this time around, the response has been perhaps more flexible. People have adapted very quickly to going back to virtual visits and virtual meetings. And I would suggest that this time we're probably doing about 80-20. 80% of our visits would be virtual, 20% would be face-to-face. We know some of our families particularly well, so we're able to make sure that our staff can be safe when visiting those families. In terms of other national developments, I just wanted to touch on child exploitation. And there's a definition at the top of this slide, because often people think about child sexual exploitation, but increasingly it's much more complex than that. We have online exploitation, criminal exploitation, including county lines, which I'll come back to, drug-related harm, the serious violence. And in children's services, we also deal with abusive relationships between children, so adolescents, and also adolescent to parent violence. Extremism and radicalisation are part of our remit, and we also deal with forced marriage and FGM, female genital mutilation. So all of that really encompasses the banner of child exploitation. I think where I would particularly draw members' attention to is the issue of county lines, which, as members will know, is the organised gangs coming from typically London, Birmingham, into local areas to widen their drug market, basically. And one of the key ways they do that is they entice vulnerable adolescents, don't actually have to be vulnerable, I shouldn't say that, adolescents into the gangs. They exploit them, they then make them traffic them around the country, they use them as mules for drugs. We have seen that increase in Hampshire. Now, it's increased nationally, we know that, but Hampshire's a large authority, and it's got good networks for transport, particularly trains. So it's a stopping off point for many of those gangs, and we have seen, as I said, increased activity. And often, and this is, I think, an important point, often these are not, the adolescents that get drawn into this are not necessarily children in care. They may not even be known to children's social care. They are just children, sometimes, unfortunately, just targeted within their local community. Now, we have a very good response in Hampshire. We have a specialist social work team, we have a specialist police team, and we've had some very good disruption activity to safeguard children. But nonetheless, it remains a significant concern in terms of exploitation. And then just something around children who go missing, which again is a national issue and something that I know all local authorities are focused on. So in children's services, we have a responsibility to see children who go missing that are known to children's social care or in care, understandably. But any child that goes missing, there should be a response from children's services. And that response can vary from a one-off visit to a detailed assessment and a safety plan. We've introduced local missing, exploited and trafficked meetings in each district in Hampshire, and they oversee this activity. And I'm really pleased to say that the numbers of children who have been going missing, whether that's missing from home, missing from their foster placement, has reduced. And we've still got more work to do on it, but we've seen some positive progress there. And then the other national development is around unaccompanied asylum-seeking children. And members will be aware, we've had presentations at this committee before, that Hampshire has been a supporter of the National Transfer Scheme. So there are two ways that children really come into Hampshire as an unaccompanied asylum-seeking child. The first is through the National Transfer Scheme, which aims to resettle children who are in Kent. Kent has has Dover, and that's the main port of entry for unaccompanied asylum-seeking children. They are over the government quota of 0.07% of their child population. So these children are being redistributed to local authorities. That is a voluntary scheme, that redistribution. And increasingly, what we've seen over the last few years is fewer local authorities participating in it. And what that means is there then becomes an unfair burden on those local authorities who say we will accept children through the National Transfer Scheme. The other way that unaccompanied children come into Hampshire is where they set foot. And our most common way is they will be on the back of a lorry and they will step off at one of the service stations on the M3 and they then become a responsibility for Hampshire. The Home Office has begun a national consultation on the future of the National Transfer Scheme and the response to unaccompanied asylum-seeking children. And really, one of the big drivers for that was Kent refusing to accept any more children during the summer. And in fairness to Kent, they simply did not have any social workers or any placements left to be able to manage the demand. With the warmer weather, more children were coming across the sea. Hampshire supported Kent by going down to the port. Our social workers were supporting those children in terms of age assessments and helping them transfer to other local authorities. And Hampshire took 12 children. But we also reached a point where, because of our increased demand, we've got to the position where we need our social workers in Hampshire working with Hampshire children and families. And so that, late in the summer, we stopped doing that. We've also been clear in our response to the consultation that the reality is the system is broken as it stands currently, and it needs to be mandated so that all local authorities receive a fair share of unaccompanied asylum-seeking children. Some of the largest authorities in the country have taken none in the last 4 years, and that does seem, certainly to myself, incredibly unreasonable. Just in terms of the graph there and the numbers coming into Hampshire slowed, and whilst it looks like we've had a reduction in our UASC, as we call them, actually those children haven't left Hampshire, they've become care leavers, and unaccompanied asylum-seeking children now make up 25% of our 600 care leavers in Hampshire. And the key issue there is the lack of funding. The funding we receive from government for the children, so those under 18, is at best just about meets the basics. But for our care leavers, it goes nowhere near meeting the costs to the local authority of supporting them as young adults. And at any one time, up to 30% of those care leavers could have no recourse to public funds. So they're not able to work, they're not able to go into further education. What we have to do is, as the local authority, is fund all of their needs, because whilst they're waiting for their immigration status to be settled, they have no access to any other funds. And again, that's something we've been very strong with our views about in the consultation, to say there needs to be some change to those systems. So that's the some key national developments over the last year or so. And then just moving on to think about some performance and activity levels. I think there's a strong story in that top table there. So you can see year-on-year increases in the amount, more or less year-on-year increases, amount of social work assessments that we're doing. And they at 92% in terms of our timeliness in undertaking what is often a complex assessment by social workers, I think is really strong performance and is certainly above the regional average and is strong nationally. Children who become subject to child protection plans are those children who would be considered to be at the most risk. And you can see there that year on year numbers come down, and I think that's reflected the really good social work interventions that have been delivered, along with partners from other agencies. It's not exclusive of social work services, that's prevented children's risk escalating. What's somewhat, not disappointing, it's not the right word, what we've seen change is for the first time in 5 years, 6 years, the numbers have started to go up since April. And that's as a direct result of the lockdown and the pandemic. And the numbers have gone up, not significantly, but they have started to go up for the first time. And I think that reflects the extra vulnerabilities that families are experiencing. We've seen issues around child cruelty and child neglect. And because other services may not have had access to those families, and certainly they may not have been known to children's social care, the risks around those children have escalated very quickly. So we're starting to see a bit of a change. And of course, we're looking ahead and thinking, well, post the pandemic, hopefully once again, our strong social work practice and our multi-agency arrangements will reduce those numbers. And again, in terms of looked after children, I think there's a strong story to tell over the last 18 months, as we've seen numbers reduce quite considerably. So nationally, there was a 5% increase, and I think we've seen a 4% decrease. So that's quite a swing after many years of increases. And of course, these are expensive issues for the council in terms of the cost of placements for these children. Again, since the beginning of lockdown back in March and the pandemic, we've seen an increase in the numbers of children having to come into care so that they are protected. And again, there's a complex set of circumstances around that. And I referred earlier to the complexity of the work in the system that is a direct result of the pandemic. And then just something around our quality assurance, which was highly commended by Ofsted. Just to reassure members, we have a very detailed auditing system so that we're constantly checking the quality of our work that we're doing with our vulnerable children and families. And over the course of a year, we will audit around 10% of our cases. So around about 1,000 cases will be audited. And myself and my senior managers re-audit the audits. So there's always this double checking of the quality of the work within the service. Just thinking about some local developments then. Recruitment of experienced social workers has been a national issue for a number of years. National vacancy rates are around 20%, and we're at about 13% in Hampshire, which is a positive story. We have a graduate entry trainee scheme where we directly sign people up before they leave university to come and be a social worker in Hampshire. And for the first year, they're in a cohort, much as they would have been at university. And we offer them a range of different experiences and a very protected role as a first-year social worker. And we've got 3 cohorts coming online over the next few months, and we must be over 200 that we've recruited now over the last couple of years. It's been a really positive story for us. However, it's still not enough, and we still use agency social workers, and that continues to be a pressure on us as a service. Second part of this slide talks about our sector-led improvement work. So we are what's known as a partner in practice, appointed by the Department for Education. And as that, we would go in and deliver improvement work for those authorities who are struggling. So we're working with Buckinghamshire, West Sussex. Our strategic partnership with the Isle of Wight continues. So we continue to run Isle of Wight Children's Services. There's a lot of work that goes on there, but one of the benefits of it is that we bring back learning into the organisation, and my staff tell me how much they enjoy delivering that improvement work in other authorities. We've covered this previously at this committee, but our transformation programme for children's social care has made significant changes to the way we work with families, aiming at keeping more children at home where it's safe and appropriate to do so. And on this slide, there are a number of elements of change that we have created. We're now moving into what's known as phase 2, because I'm very clear that we need to have a focus on continuous improvement, never resting on our laurels, but continually driving ourselves to do things better to support those families. And we've got some exciting plans on the table. We're still formulating where they'll go to, but I think the next phase of our transformation for social care will be just as impactful. And then another programme locally is our Modernising Placements programme. This is the context here is a marketplace in terms of not being enough placements for children in care. With that 5% increase nationally year on year, it's not surprising that there's a shortage of placements nationally. And our approach typically for a child coming into care would be that they would come into foster care. They might, if they're experiencing very challenging behaviour, demonstrating challenging behaviour, as foster carers may not manage them, and we may then need to move them on to a children's home. And again, that children's home may struggle. We may have to move them on to a more specialist children's home. And it seems to me that it's a bit of an escalator. And we've been talking about, actually, for some children, they may need to come into a children's home in the first instance. They may need to have a team, specialist team wrapped around them, and then for them to be able to safely go back home or return to their foster placement. And that work is well in train, and we'll see where it goes to. We will be taking a business case to the Treasurer in due course, and we'll have to see whether or not there's any potential for investment. But it's potentially a very exciting programme. And then finally, future challenges and priorities. So on the left, child exploitation, as I've said, that continues to be a challenge and a priority for us. In the bottom left, the cost of placements for looked after children, that's a significant challenge, not just for my service, but for the County Council, as members will know. We've already had additional corporate funding, significant funding, I have to say, but inevitably the costs will rise as demand increases. And then on the right-hand side, we will be continuing to meet the increasing demand for children's social care services. We've managed well through the pandemic so far, and we intend to make sure that that continues. We've still got significant plans to improve our recruitment and retention of social workers. And I think I've been saying this for about 5 years. We have a new IT system coming, which we hope will be in place by the end of next year. And I think that's taken you through the report, the key parts of the report, members. Thank you.
Thank you very much, Stuart. Councillor Jackie Porter will go straight to your question, please.
Thank you. I just wondered if Stuart would like, it's an impressive report, so thank you very much, Stuart, and it's a real credit that your team are mentioned many times about their leadership, so thank you. The question is, can you talk us through how Hampshire manages regulated and, more importantly, unregulated placements, please?
Yes, of course. We do not currently, the legislation allows us to use unregulated placements for under 16-year-olds, but we know that that is going to change. And about a year ago, we introduced a policy which said we will only use these for under 16 by exception, and with my agreement, that was a limited period. And therefore, over that period of time, the numbers have reduced significantly. So we're now at a point, I say, as of today, I don't think we have any 16-year-old unregulated provision. And if we did, it would be for a short-term emergency. So and even then, they're few and far between. Unregulated provision is and I hope will remain entirely legitimate for post-16 placement. Children who are 16 and 17-year-olds, Typically, those placements would be supported lodging with a family or with an individual. They may be in a hostel type accommodation, and we use those. We have a quality assurance framework around those, so that we know that they're insured, that there's DBS checks of the landlord, that we visited premises. And remember, 16 to 17-year-olds still have social workers who will go out to see the young people. And that's really how we use them. I just trying to think what more I would say about that. We work with the providers to make sure that where those young people have higher needs, they get additional support. So they have more than just the social worker visiting them, they will have other support from the provider as well. So there's a range of activity that goes around it. What the point I would make is the quality assurance processes that we put in place.
I'll just jump in there, partly because Stuart's network is slightly breaking up, but one bit of the nomenclature is a bit unhelpful when it comes to non-regulated, because what the phrase non-regulated means, it means not regulated by Ofsted. That doesn't mean that we don't regulate it, because we do. We have a really quite strict set of controls around the contracts and placements, and we make sure that we visit the children and make sure that we do all the checks on the housing, etc., etc. So it's unhelpful. It's unhelpful nomenclature, because they are, for authorities like us, who I believe we do things properly, they are regulated, but they're not regulated by Ofsted. They've never been regulated by Ofsted. It's not. This is not a new thing. This is, I think, increasing on the government's worry list, because risks around this, particularly in some areas, and it's fair enough. My concern is whether they will, if they regulate supported lodgings and independent hostels in the same way that they regulate children's homes, then there is going to be a national problem around this, because those providers are not set up actually to meet the same requirements as a children's home.
But there is a current gap in the system, because Ofsted regulate what Ofsted have a regulation process and CQC do, and there's a gap in between. And I'm content to hear that you're assuring the quality of what you're getting between.
Yeah.
But there is a great difference between a 16-year-old and an 18-year-old, and I'm encouraged to hear that Stuart basically takes responsibility for every child that goes into one that isn't Ofsted checked. Although I appreciate that's no more of a guarantee than anything else. It's an MOT on the day, isn't it, really, to some extent? Yeah,
and I think we also have to respect sort of individual young people's agency. You know, and people get married at 16 if they choose to.
They can shoot someone at 17. Yeah.
Yeah, some young people choose to, you know, share accommodation with boyfriends or girlfriends and things like that. There's all sorts of combinations, and these are children, young people that are heading towards independence, and sometimes we may think as adults that at this stage that's not the right decision, but at 16 and 17 it ultimately, and we can help try and change their decision, but actually we can't determine it at that age, and sometimes young people have to make mistakes, and we all understand that, I know, around this table. But our job is to be there, pick them up when they do make mistakes, and help them again.
I think my point is I'm assured by the fact that Stuart has full knowledge of those, particularly for the younger group, the younger age group. I think that's what our public would want to know.
Yeah, absolutely.
Yeah, thank you. Thanks, Jackie. Councillor Bill with us?
Thank you, Chairman. Stuart, the numbers of the unaccompanied asylum-seeking children, which has increased dramatically in the last few years, and you said they mainly come into the county on the back of a vehicle, and I presume you're indicating that's from one of our ports, or is that from the M3, the A3, the A34, and how do we determine that? That's my first question. And the second question is, looking at they're in this system and the amount of money spent on them, what are we doing to educate them in so that they can be proper members of the community, i.e. the language and skill opportunities, so that they can become proper members of the Hampshire Society?
Yeah, two very good questions, Councillor Withers. Firstly, the main way they come into Hampshire is through Portsmouth, via Portsmouth as a port. I don't think we've had any from Southampton because that's typically container, and I don't think we've had any children arrive through from any other county that I'm aware of. They're usually heading north, actually, up the A34 or up the M3 when they are found that in the back of a lorry, or that's where they choose to get off when the lorry stops.
Just to interject, Stuart, the law is first footfall in the UK. So wherever the young person sets foot outside the lorry, it is the legal responsibility of that local authority to care for them. So if they're detected at Portsmouth, it's Portsmouth. If they get off for Andover services, they're ours. That's the law on that one. Sorry, Stuart, carry on.
And in terms of education, I mean, as soon as these, so let's use the example of a young person gets off at Winchester services on the M3. They're an unaccompanied asylum-seeking child. They then become a looked-after child for Hampshire. Hampshire is now legally responsible for that child. The social workers will undertake a specialist age assessment, and I know over time I've been asked, does that involve dental checks? It's non-intrusive. It's just purely a professional social work assessment. Many of the young people will not speak English, so often we're having to use translation services. They often won't have paperwork. No paperwork at all. So social workers will work with Border Force and other professionals to best establish the age of the young person, so far as we can. Many of the children will have travelled for 6, 9, 12 months to get here. They come from Eritrea, Afghanistan. They come from basically all over the world. We will, because they are a looked after child, they will be treated like any other looked after child in Hampshire. We will ideally find them a foster home, and normally they are in the independent sector, the foster homes, typically because they have foster carers who are well used to caring for unaccompanied asylum-seeking children, and in addition they live in communities where there are other families with the same ethnicity as the child. So we deliberately will seek to support their cultural needs in that way. They will go to school. They will have extra tuition around speaking English. I recently, and I think I sent it to Steve, I recently received a photo of two unaccompanied asylum-seeking children who are Hampshire children. They're living, I think they're living in Croydon, I think is where their foster care is. And they sent a photo, both wearing Hampshire is great T-shirts. These children, they, for whatever reason, they come to the UK, and for whatever reason, they end up in Hampshire. Once they're here, they're Hampshire children, and we treat them as such. And we want them to be proud of living in Hampshire or being cared for by Hampshire if they live somewhere else. Some of them will go on to college. One or two have gone to university, and they become really make a significant contribution to society.
Thank you, Stuart. I know ascertaining the age due to the fact that none of them have paperwork is a very difficult subject, and I know from my military experience it's very difficult to judge age of any individual these days. But no, thank you for that comprehensive answer.
I recently discovered, as I understand it, but I need to check it, I think we're one of the few countries that does not use medical intervention to ascertain age.
Thank you. Councillor Malcolm Wade.
Thank you, Chairman. Stuart, thanks again for that report. It's just, again, highlights all the good work that Hampshire Children's Services are doing. I was particularly pleased you mentioned continuous improvement, because however good we are, we can always do better. And indeed, the sort of quality assurance elements. The question that I want to ask you is that Ofsted, in their recommendations, suggested that the corporate parenting board needed to change from the smaller informal body, which did get into the front line quite a lot and to look at things, to a more corporate body which could take other districts and other agencies to task. Do you see that body in respect to looked after children as part of our own quality assurance process? Because I know it's not mentioned in the report anyway as the improvement, so I'm not being flippant by that. Do you look upon it as part of our internal quality assurance process? Because all members are corporate parents, and that body is particularly tasked with looking at the best results for our looked after children.
I absolutely see the corporate parenting board as having that quality assurance function. It should be holding officers to account. It should be holding partners to account, as we've said. With the feedback from children and young people, the issues that they're raising, I would want the corporate parenting board to task officers with responding to that, making changes to the way that we care for our looked after children accordingly. So, short answer is absolutely yes.
Thank you.
Councillor Powell-Hare.
Thank you, Chair. Thank you, Stuart. That was a really, really good report, and your officers and your team do really well giving us these really comprehensive reports. I just want to ask about the children that go missing. How much engagement or contact does Hampshire have with other authorities? Just recently, 2 children were picked up here who were actually from a different authority by the police. So I want to know whether, how much engagement we have with other authorities.
We have engagement as necessary, really. So again, I think some of this is down to our size. We often have children from other authorities who they go missing and they end up in Hampshire. Now, for example, some of that could be related to the county lines issue that I talked about previously. We will then, as a local authority, speak to the other local authority. Sometimes we will place the child in a foster placement locally in Hampshire temporarily overnight, so that we can make the arrangements for them to go safely back to home or their home authority. We work with the police to do exactly the same. And when Hampshire children, and it happens, Hampshire children might decide they're going to go to London sightseeing and staying for the weekend, we will work with the Met, and we'll work with the London Borough to make sure that we find those children and they come back safely. Most children, and I think it's really interesting, most children are back within a few hours. Some children we know where they are, they will be with their wider family or with their friends. It's a very small number that we're concerned about when not genuinely, it's not the right word, when they go missing and we don't know their whereabouts, and we're concerned for their vulnerabilities. And we're very proactive in working with all local authorities around us then. But they are small by number.
And we're also very proactive in working with the police on that in ways, various ways, to see if we can track them, shall we say.
Thank you. So they're identified fairly quickly then?
They are, yes. And any child that, as I said, goes missing for any length of time and they're particularly vulnerable will have quite a clear operation with the police. I wouldn't want to, it's a public meeting and I wouldn't want to give away any police secrets, but there are a number of mechanisms that we can employ to find those children.
Thank you.
Okay, thank you. Any other member wishing to ask a question? If you could just indicate now or raise your hand. Don't see anything. Anyone wishing to debate? Any comments? In which case we will move to the recommendation, which is that the Children and Young People Select Committee note and support the recommendations being proposed to Cabinet in the attached report. Jackie, would you like to? Okay, perfect. If we're just going to,
I think a verbal agreement.
Verbal agreement.
Chairman.
Okay.
Agreed.
Agreed, Chairman.
Thank you.
Agreed.
That's great. So we'll move to item 8, which is the Child and Adolescent Mental Health Services update. We've got a presentation, and I'm going to hand over to Tim Davis, who is the Associate Director for Children's Mental Health from the Hampshire and Isle of Wight Partnership of CCGs.
Thank you, Councillor. Could I also just quickly ask Jenny Irwin and Alison Smith to introduce themselves as well, who will be, I'll be presenting, but they will also be available and open to questions. Jenny?
Good morning, everybody. Thank you, Tim. Yes, I'm Jenny Irwin, and I am the Director of Mental Health Transformation and Delivery for Hampshire and the Isle of Wight. At the moment, I am operating on behalf of West Hampshire CCG and the Partnership of CCGs, and working jointly with both of the cities of Portsmouth and Southampton.
And Alison.
Good morning, everyone. I'm Alison Smith, and currently taking the lead for Children's Service for Hampshire and Isle of Wight, amongst many other things. And as Jenny shared, we have dual roles. So I'm also the Managing Director for Isle of Wight CCG and work within Hampshire and Isle of Wight CCG partnerships. Pleasure to be here. Thank you very much.
Thank you. So I was just going to run you through a number of slides just to give you a quick overview of mental health for children and young people's performance across Hampshire in particular, current performance challenges and planned service improvements and transformation. In terms of Hampshire CAMS, we've currently got some significant challenges within the service. We have a waiting list of 1,387 children awaiting assessment and 1,480 awaiting treatment. There are 4,174 on the treatment caseload. Just to give you a sense as to current activity, 718 children were referred to specialist CAMS in September, and overall there's just over 7,000 children on the open caseload. In terms of how long it takes to get into service, 28% wait more than 19 weeks for their first assessment, and 44% of those wait over 26 weeks, 6 months for treatment. And current levels of activity by the service are 6,900 in terms of this is the delivery of direct services, but also participation in multi-agency work. In terms of September, we saw the highest ever level of referrals this September. We had a drop earlier in the year with COVID, but the return to school has seen an increase to the highest ever levels of referrals we're seeing into children's mental health services. Just to give you a slightly broader overview of children's mental health services in Hampshire, we commission specialist CAMS services, which includes things like single point of access, the core CAMS team, intensive home treatment team, which is for children in mental health crisis, an eating disorders team, and also youth offending service team. We also have, which are just in the final stage of mobilisation, mental health support teams in Havant Gosport schools, and as part of our wider commissioning, 24/7 mental health triage services via NHS 111, which can support anyone in a mental health crisis, children or adult. We commission community counselling services from the community and voluntary sector via a service called Hampshire Youth Access, and we also have embedded support commissioned, though there are vacancies in the Willow team and via Frankie workers for children and young people subject to sexual abuse or criminal exploitation. And we also commission community crisis. Sorry, yes, yeah.
Sorry to disturb you. There's a request come through on the chat bar. If you could put it into presentation mode, it will be slightly bigger for people to be able to read as you're talking through. I know it's difficult when you're actually doing the presentation yourself, you can't see the chat conversation, so sorry to disturb you and disrupt your flow.
So I'm struggling to see that bit of it.
Should just be on slideshow mode, Tim.
Right.
The top. At the top.
Is that better?
Thank you.
Yes. Yeah. Okay. Yeah, we commissioned Community Crisis Lounge for Children and Young People in Aldershot and Havant, and we also commissioned a mental health crisis helpline in the evenings for young people. We also commissioned support for LGBTQ+ children and young people, and we're rolling out the programme called the Link programme for schools that aren't covered by mental health support teams, as well as those that are, and that will be open to all Hampshire schools and colleges over the next couple of years. And we also commission digital support via the Think Ninja app. I'm going to sort of fly through some of these slides around the actual waiting lists, because I gave you a quick overview, but it's fair to say in sort of summary that waiting times and waiting lists are far too long, not where we would want them to be. They are growing at the moment. Treatment times remain fairly poor in terms of where we would want them to be, and just sort of then move to the children's mental health current key challenges. So the first thing to say is around, sorry, yes. Oh, okay. Rising levels of mental health problems in children and young people. There's been an increase in the last few years to, there was a 2020 update of national prevalence of mental health issues, which indicates it's currently at about 16%. I think only 3 or 4 years ago it was estimated to be 4% by a national survey that's been commissioned, which is run across the country. It's fair to say that investment has not kept pace with that rising demand, and that has led to essentially us having a very long waiting list, and the management of risk presenting within that waiting list has led to some of those with slightly lower level needs waiting for very long times. COVID-19 and the associated lockdown disrupted significantly regular routines, social networks and positive diversion activities. And certainly it's fair to say that some groups and families have been more affected than others by lockdown, and that there is less oversight of risks presenting for partners such as schools. Rising demand for services in other key partners such as children's services in terms of things like rising children care numbers is also a driving factor, and there's a range of wider pressures on key partners and services in primary care and wider communities. In terms of what we've been doing about that, we undertook a fairly detailed piece of soul searching work to really get under the skin as to whether the problem was a problem with our provider or whether it's a problem with investment last year, and clearly identified that there was actually a fundamental problem with levels of investment in the CAMS service. We've made progress in terms of a £1.3 million increase in core CAMS capacity over the course of last year, but that essentially took us to the point where we were closer to being able to meet what was coming through the door, rather than actually responding to COVID related sort of surge in demand. And all posts linked to that investment have been filled. I think there might be one vacancy in relation to that. In terms of CAMS crisis investment, we have made a significant investment in the expansion of the community crisis home treatment team, and also we have just confirmed investment in paediatric psychiatric liaison arrangements across all of the hospitals in the Hampshire system. So that's Winchester and Basingstoke, Southampton Hospital in terms of West Hampshire and Southern West Hampshire, and also Queen Alexandra Hospital in South East Hampshire has had confirmation now. It was close last week, but it's now been confirmed for expansion of their paediatric psychiatric liaison arrangements. In terms of eating disorders, those for Hampshire are hosted by Hampshire CAMS. Both services have really struggled to meet the national expectations around waiting times, and it's fair to say that the eating disorder patient cohort has really suffered during lockdown. It's been hard to maintain that sort of overview of supervised meals, and this is a group that has characteristic of their illness being that they are in some respects sort of secretive, and will try and indicate that they are more stable than they have been. And we've had a number of young people presenting late, very unwell, and staying for a long time in both acute hospitals and also in specialist CAMS beds. Again, service investments not kept pace with the growth in demand, up over 200% over the last 2 years for urgent cases, and routine cases over 30%. I think you had previously a report at your last meeting around autism and neurodiversity waiting lists, which currently also sit under my team. We have just agreed funding to tackle autism assessment activity and also the development of the wider neurodiversity and neurodevelopmental delay pathway, which should tackle in full the current waiting lists over the next 2.5 years. And investment and commissioning plans for that will be overseen by the SEND and Complex Care Transformation Board. There's a number of things that we've sort of learned from children and young people from COVID-19 in relation to mental health. Generally speaking, the public has been following instructions around staying at home, but we have seen that potential for unmet mental health demand emerging as the first lockdown was eased. We're expecting potentially to see something similar again. We've made huge progress in terms of digital clinical assessments and interventions. In fact, the Hampshire CAMS service remained functioning throughout the first lockdown and has remained again during the second lockdown, shifting very quickly to non-face-to-face methods, but also seeing throughout some who did still need to have a face-to-face mental health assessment. CAMS capacity sort of levels of activity have remained pretty much as we thought that they would, in part thanks to that shift in terms of technology. And in terms of the crisis pathway, we did initially see a significant fall in presentations, but we're actually seeing presentations again, as with the rest of CAMS, at higher levels than we've previously seen. And that's creating some particular challenges for children's mental health services and also for hospitals. So in terms of the preparations around restoration recovery, we anticipated 2 surges, the first at the end of the first lockdown, which we've seen, and then we're also expecting to see an increase in a number of other mental health presentations as children and young people come to terms with changed circumstances in their life. The main drivers in terms of the types of need we're seeing will be around things like separation anxiety, general mental health anxiety for those who actually fared quite well whilst being at home and then coming back out. Bereavement, which thankfully hasn't been at some of the high levels we'd potentially anticipated, but will certainly have affected many. Post-traumatic stress for some who have been in the situation. And then that wider impact of feeling that their lives are on hold in terms of the disruption to GCSEs, A-levels and things like transition between schools. And of the above, we think that potentially as many 40% might need a mental health service of those who already had some level of mental health need. We've been doing a lot of work in terms of communications to increase our level of activity in terms of digital and self-help resources for children and young people and also for families. And we've also been progressing throughout this period plans to transform mental health capacity in the longer term. We've got 4 key work streams. The first is around access and waiting times. The second is around children and young people in mental health crisis. The third is around the prevention programme for children and young people in terms of mental health and emotional well-being. And then the fourth is around the development of quality outcomes and the NHS long-term plan. These slides are just to give you a sense as to the highlight reports around how things are progressing. There's been a lot of work across each of the work streams, which is, you see in terms of the key steps and timescales, is generally progressing well. In terms of where we are around performance, our aim around assessments is less than 4 weeks, and our aim for starting treatment is less than 18 weeks. So, casting your mind back to the current performance, we're a very long way from home in relation to that. And then in terms of increased contact capacity, it's essentially through the investments in contact capacity that we will know that we are actually translating our investments into actual additional services for children and young people. Around the crisis pathway, we've confirmed investment, but we still have quite some way to go before that's fully implemented, but it will be a completely transformational level of investment in our capacity to actually respond to the challenges both of COVID and of mental health services more generally. We've found it harder to progress some of the work around positive mental health and prevention in children. The main reason for that is the level of disruption that there's been to the ordinary lives of children in terms of the benefits they get from school, from doing the things they do in the community, things they do out of hours, and from the difficulties that some of the smaller community and voluntary sector providers certainly initially had and still having to some extent in restoring their normal service offer. And it also makes it harder to commission additional things from them. And then in terms of the NHS long-term plan, we're actually performing quite well around the nationally measured access target. But then if you consider that the national expectation is that we would meet access for services for only 35% of those of young people who are estimated to have a mental health diagnosis, then that puts that 54% that we're currently achieving still into perspective, and it means that 46% aren't. So our ambition is to go way beyond that and to make sure that the timeliness is sorted. We're also committed to developing our service offer for 18 to 25-year-olds to support that transition. Again, the level of disruption in community services has made that difficult to really progress much this year. Our recently confirmed investment in eating disorders will help us get from those current levels of young people with eating disorders with either urgent or routine needs being seen within either 1 week or 4 weeks. The service has actually maintained pretty good levels of activity in relation to that. And I just really want to finish before opening up to questions with an overview of the investments that have been essentially confirmed. So as I mentioned before, 1.3 million above the 19-20 base budget is now within the Hampshire CAMS service. We are looking as we move forward to respond next to the surge capacity that's actually needed to deal both with the existing historic waiting lists and also with the increased demand that we're now seeing as a result of COVID. In terms of CAMS crisis investment, and we have confirmed investment around both the community crisis team, but also the teams that support hospital ED and inpatients around the rapid assessment and support of children and young people in mental health crisis. And we've confirmed significant uplift in terms of funding for eating disorders, both for Hampshire CAMS and on the Isle of Wight, which is a much smaller service. And then just finishing up in terms of the autism and neurodiversity pathway. This year we've confirmed 1.86 million in terms of total autism assessment spend. That compares to what we were previously spending as a rate of around £920,000 per year. So as you can see, that's a significant uplift that should allow us to address that waiting list issue that we've had. And we've also indicated that will be a recurring spend, which we think in the long term would go down to about 1.5 million, though actually some of the wider development of the neurodevelopmental pathway may actually mean that we don't see as much need if we get that wider offer of support right for families. So in terms of the presentation, that sort of covers a lot of the things I really wanted to put across. Were there any questions?
Thank you, Tim. If you wouldn't mind just stop sharing the screen.
Yeah. Is that better?
That's great, thank you. I've got Councillor Jackie Branson first for questions.
Thank you very much. That was a very comprehensive run through. Firstly, I'd just like to, you've put that there are mental health support teams in Havant and Gosport schools. I'd be quite interested to know a little bit more about that. I think we all know that a lot of mental health problems are begin at school age children. So I think, obviously anything that we can do within the school is really important. Obviously, COVID, I think it's too soon even to assess how much that's going to affect the mental health of children, both short term and even long term, because I think these are going to be a real issue. How much do you think the increase in government funding is going to be enough? Or mental health has become a more important issue recently, and I think how much funding are we going to get? Are we going to get enough? Or it's probably never enough, but what are your feelings about going forward post-COVID? Thank you.
Sorry, Jenny, did you want to come in on this?
I think if I may, it would be good to just give us a slightly more broader answer, but particularly for children and young people. I think just to kind of set in context the funding arrangements that Tim's described for 2021 and what's described as the mental health investment standard, which you may or may not be familiar with, was set out by the government as the kind of bare minimum investment that CCG should be making in mental health services, of which children's mental health is a component. And just really to set that in context, the mental health investment standard, if I just picked out West Hampshire CCG, putting COVID to one side, at the beginning of the year, we were expected to spend 10.8% of our budget on mental health. And when we planned that investment profile in, only £1.8 million of that was already uncommitted, so already not being spent on mental health service provision. So for West Hampshire CCG, which is the biggest of all the CCGs in Hampshire, which has a huge population, the only available mental health investment, if we were just to say we'll do the bare minimum and use the mental health investment standard, would have been 1.8 million, which is equal to 0.2% of our budget. So if you imagine the need around mental health more broadly, and then say that the availability for investment is 0.2%, we can start to get a scale of the inadequacy of where we started from. So I think where we've come at 2021 and been significantly hampered by COVID, as everybody else has, in trying to do anything strategic because we've been instantly tactical and nothing else, is really to start to say, let's put the mental health investment standard conversation to one side, look at the needs of our population, decide what we need to invest in on the basis of need across the patch, and then work together to make sure that absolutely wherever our investment goes, it follows the need of our population based on what we're seeing. And that is shifting, of course, with COVID, because we are seeing mental health need coming to light. However, for I think Hampshire and Isle of Wight and most services across the country, it's very different. The mental health conversation is slightly different to the rest, in the sense there isn't an immediate restoration piece like there is with cancer, for example, where we need people to quickly get back in and have, elective lists stood back up again. Is much more of a slower burn thing for us. So I think, the suicide rates, things like that, we probably won't see any impact immediately, but we can expect that to be an issue over the next 2 or 3 years. And we've got a wealth of national evidence base that tells us where we would need to go and what we can expect to see. So the piece of work we're doing now is that whole population modelling bit that says what are the outcomes we should be driving after, what's the prevalence we would expect to see, particularly drilling down into children and young people, and working with all of our provider colleagues who've got the expertise to say, okay, what services should we wrap around them, and then work that through in terms of a proper strategic investment framework. So working together as CCGs to make sure that those investments are absolutely targeting the need as we go forward. So that piece of work is very much in its infancy. We agreed to start it last week. We're very clear we need our county council colleagues and others to be absolutely part of that, to make that happen and to do that effectively. But that's absolutely the approach that we'd be taking.
And I also asked about what you're doing actually in Havant Gosport schools.
I think Steve Crocker would just like to come in on the that point that you've just made, Steve.
Yeah, I've got some information. Tim may want to supplement this, but just to give you the background on that is this was a ring-fenced piece of money, and it feels like a decade ago, but it was actually under Theresa May's premiership. When you remember, she had a big push on mental health in schools, and it was a set of money which in due course will go across the country, we're assured, and we're allowed to bid about sort of priorities. And so Havant and Gosport were priority areas and received that funding, and that's around early intervention and prevention in schools. We have bid for other areas, but we've not yet been successful. Although ultimately the original pledge was that there would be enough to go around everywhere, but it's just a question of how it rolls out. The question, of course, that is still left hanging is whether that's continues to be a priority for the current government, and I don't know the answer to that. The answer to that lies in politics, not with the DCS, unfortunately. But as it stands, that's where we are, and those people are, as I understand it, those people are in situ and beginning to help schools. I might be corrected on that with Tim. You've probably got a bit more up-to-date information than I have on that.
Yes, so you're pretty much spot on, Steve. We had 2 teams fully recruited to within those 2 areas. The focus of their activity is lower level mental health needs that can be supported in schools for children and young people who don't meet the thresholds of need for specialist CAMHS support. As Steve mentioned, there were another four MH mental health support teams that we were looking to achieve for Hampshire. Our next priority areas, New Forest, pretty much on the water side, Test Valley, mainly focused around Andover, a team in Basingstoke and a team in Aldershot, and that was sort of essentially agreed as priorities, working with children's services around which areas would most benefit initially. And the national ambition isn't quite that every school will get benefit of mental health support teams in schools. I think initially they'd set a target of 25% by 23-24, and we have to bid essentially through a competitive process against others. The Isle of Wight was successful in the last round, as were Southampton and Portsmouth, but the main prioritisation is based upon additional social need and context. So we have to really sort of focus upon those areas that most benefit it. The teams in Gosport and Havant have that they don't fully qualify and start going completely live until January, but they are in place and they've been talking to schools. That they support named schools, so they don't support all of the schools in that area, and it's a distinct additional offer. And that's where the link program that I also mentioned is part of our response to try and make sure that all other schools can access additional support in terms of their understanding of how to help people, how to help children and young people, but also how to help schools develop a whole school approach in their behaviour policies, etc., around supporting good mental health. But yeah, thank you for the question.
That sounds good. I just wondered can we know which schools in our area are likely to be supported?
In terms of the Havant and Gosport?
In Havant, well, yes.
Yeah. I couldn't reel off the names of the schools, but I can certainly provide that information for you.
Thank you.
Thank you very much,
Thank you
Tim.
very much.
I've got Councillor Jackie Porter next, please.
Thank you, Tim. And it's encouraging to at least hear that investment is going in this year. How on earth are you going to gear up to be able to staff all that so that you can spend that money?
That's a really good question. We've been talking to services around the challenges of addressing this for some time, and they know the sort of workforce they need. One of the things that services have been working closely with Health Education England on is the growth of this workforce, but actually the scale of investment that we're talking about has also involved some close conversations with neighbouring CAMHS services to make sure that we don't just destabilise other services by stealing the same small staff group. So quite a lot of it will be around trying to grow that workforce, but some of that will take time. Some of it is also about then trying to sort of attract people back from sort of other areas who have that skill set. A lot of it has been around frustration. I mean, there's actually a large number of people with skills in psychology and fewer in psychiatry, but there is more potential for that funding to make a really quick benefit now because some of the constraints have been around funding previously. But it's it's clearly going to be a sort of key mobilisation challenge. Yeah.
So being realistic, will you actually spend all that money this year, or will it take? Do you have a programme over a period of time? Because,
so the funding is recurring. We're not expecting to have much of that in place until probably the final quarter of this year, and realistically, we won't have it for all of the final quarter of the year. But we're also working to develop, particularly around the crisis, which is where we've made the majority of our investments, to develop the conversation with adult psychiatric liaison service, and really to try and develop that wider all age response to children and young people's mental health crisis support. So we're open and working, and we want to be sort of clinically led as well with services around what the most pragmatic response will be to actually establishing quickly the additional support that we need. I haven't got all the answers to sort of give complete assurance on the fact we can definitely do all of this quickly, but what we're really saying to providers is the finance won't be the problem here, and we're obviously keen to work as a whole system to try and identify and mobilise that additional workforce capacity as soon as we can.
So having seen it, yes, I was going to say, just say it'd be interesting to follow that through over the next few years and see how that changes and if that changes the needs.
Yes, yeah, and we're clearly anticipating that if we can get the prevention offer right, which is a more strategic part of our approach, that we shouldn't need in the long term really high levels that we're looking to invest at the moment in terms of mental health crisis. But what we want is a flexible workforce that can respond to different levels of need, and then we can redeploy as necessary to the population needs that we're actually seeing.
Thank you.
Jenny, did you want to come in on that? You've raised your hand.
Yeah, I was just going to add to Tim's point, and just to say actually that the mental health long-term plan more broadly describes an increase in the workforce of 27,000 extra people. So as you can imagine, they're not going to come from existing workforce. We're not just going to stick job applications on NHS jobs and hope all of those people that aren't busy doing anything will step forward. So I think there is a huge piece of work around, particularly from Health Education England, around the creation of new roles as well, and being less traditional about doctors and nurses, and making sure that actually we've got that flex within the workforce, etc. But I also think that many of our providers are coming from a deficit position as well. So you build new workforce in, but you've also got to get yourself up to full recruitment in the first place. But I think if we're not careful, we do get stuck in a cycle of we can't press ahead with 3 or 4 5-year workforce development strategies because we don't know what next year's budget and the year after's budget looks like. So we have to make sure that we make a realistic assumption of how much is spendable, because we also can't describe a budget which at the moment doesn't balance, because we know it doesn't. But actually, we can have a huge debate over balancing the books, which isn't a realistic assessment of what we can actually spend. So it is always a to and fro between the two, but we need to absolutely make sure that our provider colleagues can press ahead of developing their plans without worrying about, a part year effect, or the fact that in 12 months time, funding will run out for X, Y, or Z. So we absolutely need to move them into a place where they can focus much more strategically on that. So all of our providers are in the community sector are predicting significant growth in workforce at a high level, which is fantastic. So essentially our plans for next year look like, for our provider colleagues in community services, they're going to grow their workforce by around 10 to 12%, and our acute colleagues are planning to keep their workforce very static, which really does mean that we've started to get that successful transition of moving all of our funding away from big acute hospitals spending lots of money on the wrong end of care, and sucking that investment out and making sure that it gets delivered in the community, which leans us much more towards the prevention end of the spectrum. So it's always a challenge, but absolutely where our focus is in terms of the strategic approach to workforce planning.
Thank you. We've got a question from Kate Watson next, please.
Hello, yeah, just a couple of questions. One is, are the waiting lists, are they more localised? So in certain areas, are they going to vary? Especially the one that's got the early support in schools, has that had an effect on the waiting list? And the other one is how to try and prevent the escalation of the needs of the children. So one that might present with withdrawing behaviour, school refusal, could then lead on to self-harming, which could then lead on to suicide attempts. Is there any way to pick up those children that are likely to escalate?
Okay, so in relation, thank you for the question. So in relation to the first part of your question, yes, we can drill down. I mean, we can report at CCG level, but in practical terms, the core CAMS offer is across Hampshire is comprised of 8 area-based teams, and clearly we know the level of weight, and it does vary from team to team. In terms of the impact of services around identifying the escalation of children, one of the sort of things that is disruptive about having the levels of waiting lists that we currently have is that in addition to supporting those currently under treatment, you have to invest ever increasing sort of amounts in managing how those young people awaiting assessment or treatment are actually doing. So there's quite active arrangements in place to try and ensure the safety of those awaiting treatment. Obviously, once in treatment, there's a much closer ongoing eye in terms of how young people's mental health is progressing. But we do have, by way of sort of business continuity and quality assurance, management of the waiting lists too, just to make sure that those at the lower end, but who do meet thresholds for care, but who are still waiting, are actively sort of managed. And that's one of the reasons that we need to try and reduce that, because clearly you can, when you do that, you have some young people, and particularly those with ADHD, which attention deficit hyperactivity disorder, can wait for a very long time for their assessment and treatment, because they are relatively lower risk of progressing or regressing and deteriorating than some of the other children on the waiting list. But what that means clearly is that those young people are failing to thrive because they're not having their ADHD needs met as promptly as they might do. And that's why we really have to get to a point where we have a sustainable level of capacity in this service, so that everyone gets the timely treatment that they need when they do meet the threshold for a specialist mental health intervention. Some of the other parts below that will be around our development of tier 2 services in communities to try and improve that working of the really early help stuff below specialist CAMS. Does that answer your questions, Kate?
Yeah, I think so. Yeah, obviously it's not an easy question, but yeah, is there any way to sort of up the training level of, say, the LSAs that deliver ALSA to work closely with you rather than specifically new staff in a school to support it?
I think that's a really interesting point, and yes, there's clearly is potential for us to do more in collaboration with children's services around that space, not only in relation to ELSAs in schools, but developing that earlier help offer to support what whole school approaches to this. It's not specifically just the remit of the NHS to sort of do that unto schools, but it's an area where there's clearly a difference to be made, and where we will be keen to explore the potential. And we are having already conversations with children's services colleagues around education to sort of think about how that looks, and programs like the Link program are partly around the development of that offer and that sort of joined up approach between those professionals that support emotional well-being at the school level.
Yeah, brilliant. Thank you.
Thanks. Councillor Anne Briggs, please.
Thank you, Chairman, and thank you, Tim, for such a comprehensive report. You've got so much to do. In one way, you've answered my question, because prevention is the best thing that we can do. In an ideal world, we wouldn't need you. So what research is going into, because for children's mental health, it's such a wide spectrum. It's from all walks of life, family life. What's happening to our children to make them need this help? Is research going into this? I know it's an awkward question, but it does bother me.
Yeah, it's $1 million question, if not more. And I think it is a really tough one. I think lots of people will probably have theories about why the prevalence of mental health difficulties have been increasing, and they were before COVID as well. I don't hand on heart say that I can know why young people are increasing numbers less happy than they were previously and needing support around mental health disorders. There is quite a lot of research that tries to drill down into different levels of understanding about what helps from a prevention point of view. I mean, you know, it without wanting to stray into sort of political sort of waters too much. I mean, you know, there'll be issues around attachment and quality time that families spend together. There will be issues in terms of impacts for some of really challenging social contexts. But actually, in many ways, we're also the healthiest we've ever been in some pure physical senses. So there may be pressures around anxieties about the future, worries about the environment. There's lots of research that we get from asking young people about the things that worry them, but many of them are the same things that have worried young people for many years as well. So the exact drivers that are causing and driving this sort of rise in demand are quite hard to sort of pinpoint. They're certainly not local ones. They seem to be much wider than that. I think it's not even just this country. I think it's true across many parts of the Western world that actually something about modern life seems to be disgruntling for young people in terms of their level of life satisfaction.
Thank you, Tim. I know it wasn't an easy question. Thank you.
Thanks. And Jenny, you'd like to come in?
Yes, I just wanted to build on Tim's point and just to say really, one of the things that COVID has done is really shine a light on the inequalities within our societies nationally. And one of the things that Professor Lewis Appleby said is that, you know, COVID is now running, you can see it running through the fault lines in our society, which is really where the national evidence base has started to go around how we look at the inequalities in different components of society and what the impacts we can expect to have on them. And so the kind of national task force that's looking at children, at the efficacy of intervention, I guess, for children and young people, has started to say, actually, what's the best intervention? How should we model demand and need? And there is now turning its attention to that question. Actually, what are the kind of the key factors that we need to get behind in terms of the sort of the wider determinants of health that really do indicate where we can expect to see the worst outcomes for people, and then how do we tackle those wider determinants of health issues to prevent us needing to tackle on an intervention level through the NHS services for people who've not had that early intervention and preventative factors in place. So I think that evidence base is building, and there is nationally, you know, groups and communities that start to focus in that way. And I think it's people getting again out of the tactics and into the headspace to be able to start looking at that horizon and having a much more long-term lens on life really now. But there is lots of work going on around that, as Tim said.
Thank you.
Thank you.
Councillor Malcolm Wade, please.
Thank you, Chairman. Tim, I often, when you come to do these reports, I often feel sorry for you because generally there's a lot of negativity in them. And this time you brought some positivity down to funding. You're going to get some extra funding. I also welcome the fact that you're looking for early intervention in the water side, because as a councillor for that area, I know there's a great need for that. And there are many families and young people with problems in that area. I'm not so happy that your target for treatment is less than 18 weeks. That's still a long time for a child with a mental health issue, but I know you'd want to work for that. The question I want to ask you, and I've listened to what Jenny said about finance, you've produced a package to fight the fire that we have at the moment, and it, you know, and it looks like, okay, that will work. We've talked about, we don't know why, but we have an increasing demand even before COVID and it's ongoing demand. It's not a peak for support for children with mental health issues. And we're going to have COVID on top of that. What I don't see, and forgive me if I've not picked it up, is a sustainability plan. Because, you know, you may cure the problem for, or do a lot way for this year, even without COVID. There needs to be a long-term sustainability plan. And you mentioned that earlier, and I was pleased to hear that, because that's what we need. We need a strategic sustainability plan to manage the ongoing mental health demand for young people. Because if we don't, it will get worse, and you might end up with. You may deal with the backlog at the moment, and for COVID and for other reasons, we might be back at square one again if the funding doesn't come, because clearly funding is a big element in that. Recruiting 27,000 people isn't done overnight. That's quite a challenge, I would imagine. So this is not a quick fix by any stretch of the imagination, but you're going in the right direction. But it's the sustainability plan I want to see, because without planning for how we manage going forward, we're going to end up in more problems. And I really do want you to, CAMS, to succeed in dealing with the mental health issues for our children.
I'm good respond to that if I may, and thank you for the question. I've got some slightly bad quality network quality, so apologies if I drop out at some point soon. But in terms of the strategic response to that, one of the things that we have to do, not just as an NHS, but as a whole system, including children's services, public health and other partners each year, is refresh a thing called our local transformation plan for children's mental health services. And I think the focus of our initial response to where we're starting from right now is that we need to fix the things that only the NHS can really do in terms of getting mental health offer right. I think there is a much wider space that people alluded to around that wider joined up integrated response to prevention around mental health from building resilience, promoting well-being, and that space is something we need to really explore with health visiting service, starting literally from the beginning in terms of promoting in early years good resilience and mental health, working with health visiting, school nursing, working with schools, working with other targeted services that work more particularly with those groups of young people, whether they're Black and minority ethnic communities, whether they're LGBTQ plus communities, who we know have a higher level of challenge in relation to the prevalence of mental health issues, and really understanding that wider community need and getting to those determinants of sort of wider health and well-being. We will be looking to make sure that our next refresh, which we need to complete by the end of March, very much talks to where we're starting from, but is inclusive in terms of its aspirations for a joined up system response, and clearly we will be working with with children's services, with schools, colleges, and wider parts of the public health system and other services to try and make sure, and the community knowledge sector, to try and make sure that offer feels right and that it's rooted in a longer term vision for how we get on top of this. But as I mentioned, I think in the presentation, some of those wider preventative community services that underpin good mental health and emotional well-being in children, playing football, with groups of friends, playing other sports, obviously inclusively, music, drama, arts, many of those things, those things that young people do are less available to them at the moment, and we need to sort of build not just around the moment we're in, but around really building upon the possibilities of that wider system to fully play its part. But not all of that is on the NHS, obviously. We need to just be inclusive in how we design what we do to complement those things that the wider system also does, because we're very aware, you know, there's essentially 7,000 of the young people in in Hampshire accessing specialist mental health services in Hampshire. There are hundreds of thousands of young people in Hampshire who are served by people who want the best for them, and we need to actually actively engage that wider workforce around this.
Okay, thank you.
Thanks. Councillor Peter Edgar.
He's on mute, Chairman. Councillor Edgar, you're on mute.
Yes, I'm. To Mr. Davis, thank you very much for the excellent report. I've been sort of represented with schools for too longer than I can remember, and I was fascinated that we come to this very difficult time and the schools themselves in Gosport are going to be looked at, and I'm delighted with that. I would just like to follow it, who those schools are. I'll follow it up. It's something that I've always followed, this sort of thing, and the preparation that you've given for my thinking with it today has been excellent. So thank you very much, Mr. Davis.
No, thank you. And as I say, I can share the details of those schools that are going to be covered both in Gosport and in Havant via perhaps via the Jackie in relation to being shared.
I will be quite happy to keep that private. Thank you very much. Thank you for that.
Thank you, Peter. Thank you, Tim. Any other question or comment from members? Can't see any, so thank you very much. Thank you, Tim, Jenny, and Alison for coming along. Oh, Jackie, sorry, Jackie Porter, second question.
Right. Just a comment that in view of Tim's comment that they were trying to get their workforce up to a good level by the end of this quarter, the last quarter of this year, it'd be really useful to have an update of how that's going by that stage. I realise that will probably be just after the next elections, and it might not all be us sitting here, but I'm sure it would be of use to know that rather than waiting another year, because it would give us an idea of what progress you're making now that you've actually got the funding. I wonder if Councillor North would consider that.
Certainly, Jackie, we can raise that in the work programme if you like. So thanks. We'll move to our recommendation then, and that is that the Children and Young People Select Committee note the update provided in the presentation. And I'm sure we're all agreed on that, but if you'd just like to verbally agree.
Agreed. Agreed, Chairman.
Agreed.
Thank you, and thank you very much, Tim, Jenny and Alison.
Thanks for your interest. Bye-bye.
Thank you. We've got item 9, which is our update on autism services commissioning for children and young people in Hampshire. We've just heard from Tim about that, but this is our written update, which has come as a result of our last meeting. You can all see the notes, pages 243 to 248 in our agenda pack. And any questions that members have on this, we will just go back and deal with by email, and then responses will be distributed to all members, just so that it takes a bit of pressure off our own agenda. So if anyone has any questions they'd like to raise now, or if they're happy to email those, either way we can get a response to them. We'll pause. I'm not seeing any hands. Is that okay? Perfect. So in which case, if we could just note the update that we have received. Are we all agreed to do that?
Agreed.
Noted, Chairman. Agreed.
Thank you very much. In which case we move to item 10, which is the work programme. We've got some changes, I believe, which are highlighted in red, so you can see those. Just get it up on my screen. I understand, Jackie, your point about bringing back the CAMS update, and that may be for potentially the June-July meeting. As you mentioned yourself, the election, I'm sure the date of that meeting would be firmed up once that had happened, and that could be something that we could consider for the next round of select committee meetings following the election. Jackie Taylor.
Thank you. Just sorry.
Oh, sorry, Chairman.
Sorry.
Just to confirm that we haven't yet firmed up the dates for the HCC meetings for 2021-22. So when they are, so we have done a rough sort of indication as it will be about June-July time. So it can, if members would like to assign the CAMS, a further CAMS update to then.
Councillor Jackie Porter. Did you want to come in?
I think it was, yes, I think that would be really appreciated. And I think it's specifically about how they're managing to grow their workforce to actually spend that money, as well as really what progress they're making on those waiting lists. That would be really helpful.
I'm very happy to put that onto that timescale on that meeting there. Once we have those dates firmed up, and provisionally put that onto the June-July meeting. Has anyone else got any comment on the work programme? No, in which case we will formally request the webcast is stopped, please.